What is the most serious potential adverse effect of rifampin use? A. Liver failure. B. Gastric ulceration or bleeding. C. Nephrotoxicity. D. Seizures. The answer is A. Liver failure. Hepatotoxicity and potential liver failure are the most serious potential adverse effects of rifampin use. Patients on this medication must establish baseline liver function tests and be monitored for liver damage. None of the other conditions listed are associated with rifampin use. Aminoglycosides are primarily used for infections by what type of pathogen? A. Yeast and fungi. B. Both gram-negative and gram-positive bacteria. C. Gram-negative bacteria only. D. Gram-positive bacteria only. The answer is C. Gram-negative bacteria only. Aminoglycoside antibiotics are used to treat gram-negative bacteria. They have not been shown to be effective against gram-positive bacteria and are not antifungal. Recall the major difference between the gram-negative and positive bacteria are their cell wall composition. Gram-negative have a small proportion of peptidoglycan and a high proportion of lipopolysaccharide, while gram-negative bacteria have a large proportion of peptidoglycan. Which of the following is an example of an aminoglycoside antibiotic? A. Streptomycin. B. Clindamycin. C. Erythromycin. D. Azithromycin. The answer is A. Streptomycin. The only aminoglycoside antibiotic among those listed is streptomycin. Other examples of aminoglycosides include tobramycin and gentamicin. All aminoglycosides either end in mycin or mycin. However, this suffix is not exclusive to aminoglycosides. It is also seen in the macrolides, erythromycin and azithromycin and both macrolides, and in lincosamides such as clindamycin. Fluoroquinolones such as ciprofloxacin may cause which of the following serious side effects? A. Seizures. B. Liver failure. C. Irreversible peripheral neuropathy. D. Sudden tendon rupture. E. All of these. The answer is E. All of these. Fluoroquinolones, the most commonly prescribed of which is ciprofloxacin, carry a risk of all of the following adverse effects: sudden tendon rupture or tendinitis, hepatotoxicity or liver failure, seizures, and permanent peripheral neuropathy. Other adverse effects include Clostridium difficile-associated diarrhea, bone marrow suppression, Stevens-Johnson syndrome, tremors, and psychosis. The majority of these adverse effects are seen in higher numbers in children and the elderly. Which of the following antibiotics is least likely to cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea? A. Vancomycin. B. Clindamycin. C. Amoxicillin. D. Ampicillin. The answer is A. Vancomycin. All of the drugs listed frequently cause Clostridium difficile overgrowth and Clostridium difficile associated diarrhea except vancomycin, which is often used as a treatment for persistent Clostridium difficile infections. Which of the following antibiotics is contraindicated in pregnant women and small children due to its tendency to irreversibly stain developing teeth? A. Fluoroquinolones. B. Tetracyclines. C. Beta-lactam antibiotics. D. Aminoglycosides. The answer is B. Tetracyclines. Tetracycline antibiotics are contraindicated in pregnant women and small children due to their tendency to irreversibly stain developing teeth. They can also affect fetal bone growth and so are pregnancy category D, known incidence and risk of fetal harm. Which of the following antibiotics is considered safe in pregnancy? A. Gentamicin. B. Levofloxacin. C. Doxycycline. D. Amoxicillin. The answer is D. Amoxicillin. Of the antibiotics listed, amoxicillin is the only one considered safe in pregnancy. Doxycycline and gentamicin are both pregnancy category D, known to cause fetal harm. Levofloxacin is category C, fetal harm cannot be ruled out. Penicillin is used to treat what type of microbe? A. Gram-positive bacteria only. B. Fungal infections. C. Gram-positive and gram-negative. D. Gram-negative bacteria only. The answer is A. Gram-positive bacteria only. Penicillins belong to a larger class of antibiotics known as beta-lactams. These antibiotics inhibit cell wall synthesis and are exclusively used to treat gram-positive bacteria. They are not effective against gram-negative bacteria or fungi. The answer is A. Fluoroquinolones. Fluoroquinolones are considered to be the treatment of choice for E. coli infections due to their effectiveness in relieving diarrhea and minimal serious adverse effects. Aminoglycosides and beta-lactam antibiotics may also be effective, as a second choice. Which of the following class of antibiotics is considered the first-line treatment for E. coli infections? A. Fluoroquinolones. B. Tetracyclines. C. Macrolides. D. Aminoglycosides. The nurse considers administration of gentamicin. Which of the following is not a side effect of this medication? A. Nausea. B. Nephrotoxicity. C. Ototoxicity. D. Diaphoresis. E. Anorexia. The answer is D. Diaphoresis. Gentamicin, an antibiotic and aminoglycoside, inhibits protein synthesis of gram-negative bacteria. It treats severe systemic infections. It may cause ototoxicity and nephrotoxicity, as well as anorexia, nausea, vomiting, and diarrhea. Diaphoresis is not a common side effect of gentamicin. Diaphoresis is the medical term used to describe excessive, abnormal sweating in relation to your environment and activity level. It tends to affect your entire body rather than a part of your body. This condition is also sometimes called secondary hyperhidrosis. You are the nurse taking care of a patient who is being treated with levofloxacin, a fluoroquinolone antibiotic, for pneumonia. Which of the following choices best describes the mechanism of action of fluoroquinolone antibiotics? A. Disruption of peptidoglycan cross-linkage. B. Inhibition of topoisomerase II. C. Disruption of mycolic acid synthesis. D. Inhibition of peptidoglycan synthesis. E. Blockage of tRNA ribosome, mRNA complex binding. The answer is B. Inhibition of topoisomerase II. This is the mechanism of action of fluoroquinolone antibiotics, such as levofloxacin. The other choices are incorrect for the following reasons: blockage of tRNA, ribosome, mRNA complex binding is the mechanism of action of tetracycline antibiotics. Disruption of mycolic acid synthesis is the mechanism of action of various antifungal agents. Disruption of peptidoglycan cross-linkage is the mechanism of action of vancomycin. Inhibition of peptidoglycan synthesis is the mechanism of action of beta-lactam antibiotics. You start a 32-year-old, HIV plus Caucasian male on acyclovir, Zovirax, for a herpes simplex virus, HSV, infection. What is the mechanism of action of acyclovir? A. Acyclovir binds to the hydrophobic sites on the influenza virus capsule. This destabilizes the virus, not allowing it to attach to the cell. B. Acyclovir prevents viral uncoating and inhibits production of viral mRNA. C. Acyclovir serves as a captoviral mRNA and prevents binding of reverse transcriptase. D. Acyclovir binds to ICAM1, preventing viral attachment. E. Acyclovir is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. The answer is E. Acyclovir is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. Acyclovir is converted to acyclovir triphosphate and incorporated into the synthetic pathway for viral DNA as a guanosine molecule. The initial phosphorylation of acyclovir is carried out by viral thymidine kinase. Acyclovir has a higher affinity for viral thymidine kinase than mammalian thymidine kinase. Therefore, acyclovir is specifically effective in virally infected cells. Identify the antiviral agent that blocks assembly of pox viruses by inhibiting viral protein synthesis. A. Phosphanoacetic acid. B. Dideoxyinacine. C. Methizazone. D. Amantadine. E. Azidothymidine. The answer is C. Methizazone. Methizazone blocks synthesis of viral mRNA and proteins. This is especially evident in pox viruses. Methizazone has been used to treat smallpox. Smallpox was caused by two variants, variola major and variola minor. The risk of death following contracting the disease was about 30%, with higher rates among babies. Often those who survived had extensive scarring of their skin, and some were left blind. The last naturally occurring case was diagnosed in October 1977, and the World Health Organization, WHO, certified the global eradication of the disease in 1980. Smallpox is one of two infectious diseases to have been eradicated, the other being rinderpest in 2011. One interesting question for you. If smallpox is caused by variola virus, then what is great pox, and what is it caused by? I will give you the answer towards the end of today's questions. You are prophylactically treating a 84-year-old Caucasian male with amantadine and vaccination for avoidance of an upcoming influenza outbreak. The patient is to receive 100 mg BID for 8 days. What potential side effects would you look for with amantadine toxicity? A. Hyperbilirubinemia, nausea, jaundice. B. Low blood pressure, bradycardia, premature ventricular contractions. C. Nervousness, insomnia, anxiety. D. Elevated BUN, hematuria, nausea. E. Leukopenia, anemia, increased susceptibility to infection. The answer is C. Nervousness, insomnia, anxiety. Amantadine affects the central nervous system, producing mild, reversible disturbances. High dosages have been reported to induce seizures. Cases of invasive pulmonary aspergillosis occur in severely immunocompromised patients. The drug of choice for the treatment of these infections is A. Fluconazole, B. Griseofulvine, C. Amphotericin B, D. Ketoconazole. The answer is C. Amphotericin B. Aspergillosis is an opportunistic fungi. The opportunistic mycoses are a group of fungal infections that occur almost exclusively in immunocompromised patients. Examples are zygomycosis, candidiasis, cryptococcosis, and aspergillosis. Aspergilli are widespread in the environment, and their conidia are easily dispersed and inhaled. These organisms are capable of causing a pulmonary infection in the immunocompromised patient, which rapidly disseminates and causes infection in virtually every organ. The drug of choice for the treatment of these infections is amphotericin B. A polyene macrolide antibiotic, amphotericin B works by forming pores in the fungal cell membrane. The other listed compounds are antifungal agents, however, their selectivity makes them unsuitable for the treatment of aspergillosis. Which of the following is atotoxic and nephrotoxic? A. Erythromycin, B. Doxycycline, C. Gentamicin, D. Ceftriaxone, E. Ampicillin. The answer is C. Gentamicin. Gentamicin belongs to the aminoglycoside antimicrobial agents. It is a bactericidal agent with a wide spectrum of activity against gram-negative and gram-positive organisms. It irreversibly inhibits protein biosynthesis by acting directly on the ribosome. Gentamicin binds receptors on the 30S subunit of the bacterial ribosome and inhibits protein synthesis through interference with the initiation complex, misreading of the code on the mRNA template, and causing polysomes to dissociate into non-functional monosomes. Ototoxicity and nephrotoxicity are the most serious adverse effects of gentamicin. Ototoxicity is manifested as vestibular dysfunction, which may be due to destruction of hair cells. If renal failure is present, the probability of ototoxicity is greater. Nephrotoxicity is more common with gentamicin than with any of the other aminoglycosides. It can produce acute renal insufficiency and tubular necrosis. Bacterial-acquired resistance to aminoglycoside antibiotic agents occurs by several mechanisms. From a clinical standpoint, which of these is most important? A. Inactivation by microbial enzymes. B. Retarded penetration of the drug through pores in the microbial outer membrane. C. Alteration of microbial ribosomal structure. D. Failure of the drug to penetrate the microbial cytoplasmic membrane. Bacterial-acquired resistance to aminoglycoside antibiotic agents occurs by several mechanisms. From a clinical standpoint, which of these is most important? A. Inactivation by microbial enzymes. B. Retarded penetration of the drug through pores in the microbial outer membrane. C. Alteration of microbial ribosomal structure. D. Failure of the drug to penetrate the microbial cytoplasmic membrane. A 37-year-old man is admitted to the hospital after being diagnosed with tuberculosis. Before treatment is started, you inform him about the most common ways of transmitting the tubercle bacillus, as well as the medications used, isoniazid, rifampin, and pyrazinamide. What is a common side effect of rifampin therapy? A. Reddish body fluids. B. Jaundice. C. Hyperrhythmia. D. Polyneuropathy. E. Muscle pain. The answer is A. Reddish body fluids. Initial treatment for pulmonary or extrapulmonary tuberculosis is isoniazid, INH, rifampin, RMP, and pyrazinamide, PZEA, as a short-course intensive daily regimen for 2 months, followed by INH and RMP for 4 more months. The most common side effects of rifampin are reddish urine and stool, saliva, sweat, tears, diarrhea, joint pain, back pain, swelling of feet and/or legs, and blood in urine. Rifampicin is an intensely red solid, and this is the reason for the body fluid discoloration. Hyperrhythmia is a major toxic effect of pyrazinamide. Other toxic effects include fever, indigestion, urticaria, photosensitivity, and joint pain. Isoniazid can cause polyneuropathy, jaundice, muscle pain, confusion, and unsteady walk. A nurse in your office may have been exposed to blood from a patient with AIDS. She was administering an antibiotic injection intramuscularly to a HIV-positive patient and accidentally sustained a needle prick injury. As part of her post-exposure prophylaxis therapy, you instruct her to begin daily tenofovir. What is the mode of action of this medication? A. Is an extremely effective inhibitor of the host cell RNA polymerase. B. Prevents the virus from entering the cells. C. Is incorporated into viral DNA as a purine analog causing chain termination. D. Blocks the viral enzyme in reverse transcriptase. E. Cannot be phosphorylated by host cell enzymes. The answer is D. Blocks the viral enzyme in reverse transcriptase. Tenofovir is categorized as a nucleoside analog reverse transcriptase inhibitor, NRTase. An NRTI's mechanism of action is to block reverse transcriptase, an enzyme that enables the human immunodeficiency virus 1, HIV-1, to flourish. This enzyme aids the HIV virus in making a copy of DNA from the viral RNA, and this DNA is incorporated into the host genome. The effectiveness has been found in a review conducted by the Centers for Disease Control and Prevention to be so effective that pre-exposure prophylaxis can potentially be a vital option for HIV prevention in early at very high risk for infection, whether through sexual transmission or injecting drug use. In regards to post-exposure prophylaxis, PEP, the United States Public Health Service recommend the use of tenofovir, emtricitabine, or a combination drug of these 2 medications, plus raltegravir for PEP in occupational exposure scenarios. The answer is E. Flucytosine. All of the drugs are antifungal agents, but only flucytosine has been associated with bone marrow suppression and synergizes with other drugs which suppress bone marrow functions. Meconazole and ketoconazole may produce hepatotoxicity, gastrointestinal upset and headaches. Amphotericin B may produce nephrotoxicity while itraconazole is associated with gastrointestinal upset and rare liver dysfunction. Which of the following antifungal agents is associated with bone marrow suppression and renal failure? A. Itraconazole. B. Ketoconazole. C. Meconazole. D. Amphotericin B. E. Flucytosine. The other mechanisms listed are utilized by other antimicrobial agents. For example, all beta-lactam drugs are selective inhibitors of cell wall synthesis, and therefore active against growing bacteria. Sulfonamides are structural analogues of PABA that is necessary for folic acid synthesis. By competitive inhibition, the drug interferes with folic acid synthesis. Folic acid is an important precursor to the synthesis of nucleic acids. Quinolones are examples of antibiotics which inhibit bacterial DNA synthesis by blocking of the DNA gyrase. Antibiotics, polymyxin and colistin, and the antifungal agent amphotericin B act by inhibiting cell membrane function. The tetracyclines are a group of widely used broad-spectrum antibiotics. Antimicrobial activity of tetracyclines involves which of the following mechanisms? A. Inhibition of cell membrane function. B. Inhibition of microbial DNA gyrase. C. Inhibition of microbial protein synthesis. D. Inhibition of microbial cell wall synthesis. E. Inhibition of microbial folic acid synthesis. The tetracycline antibiotics possess a wide range of antimicrobial activity against gram-positive and gram-negative bacteria, as well as rickettsia, mycoplasma, chlamydia, ureaplasma, some atypical mycobacteria, and amoebae. These drugs are primarily bacteriostatic and act by inhibiting microbial protein synthesis. The tetracyclines, after active transport into the cell, bind to the 30S ribosomal subunit. This prevents the access of amino acid tRNA to the acceptor site on the mRNA ribosome complex, inhibiting the addition of amino acids to the growing peptide chain. This effect is, for the most part, reversible, and removal of the drug results in loss of action. You are prophylactically treating an 84-year-old man with amantadine and vaccination for avoidance of an upcoming influenza outbreak. The patient is to receive 100 mg BID for 8 days. What is the antiviral effect of amantadine? A. Amantadine binds to the hydrophobic sites on the influenza virus capsule. This destabilizes the virus, not allowing it to attach to the cell. B. Amantadine serves as a captoviral mRNA and prevents binding of reverse transcriptase. C. Amantadine binds to ICAM1, preventing viral attachment. D. Amantadine is phosphorylated by viral thymidine kinase and used as a defective guanosine analog in viral DNA synthesis. E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. The answer is E. Amantadine prevents viral uncoating and inhibits production of viral mRNA. Amantadine only works after viral attachment to the cell, preventing viral uncoating. It is also believed to interfere with viral mRNA production. Amantadine is effective against influenza virus A. A patient comes to your office with a severe eye infection. You prescribe eye drops containing a mixture of the antibiotics gramicidin, neomycin, and polymyxin B. What does the mechanism by which neomycin acts as an antibacterial agent involve? A. Inhibiting protein synthesis. B. Inhibiting DNA replication. C. Stimulating translation. D. Preventing cell wall synthesis. E. Forming a channel in the membrane. The answer is A. Inhibiting protein synthesis. Neomycin belongs to the aminoglycoside antibiotics. They act by inhibiting the 30S subunit in protein synthesis. Neomycin, when given orally, is not absorbed from the gastrointestinal tract and has been used as a preventive measure for hepatic encephalopathy and hypercholesterolemia. By killing bacteria in the intestinal tract, it keeps ammonia levels low and prevents hepatic encephalopathy, especially prior to GI surgery. It works as an antibiotic that is active against streptomycin-resistant bacteria, including in the case of tuberculosis organisms. It has also been used to treat small intestinal bacterial overgrowth. It is not given via injection, as neomycin is extremely nephrotoxic even when compared to other aminoglycosides. The exception is when neomycin is included, in very small quantities, as a preservative in some vaccines, typically 25 micrograms per dose. Which of the following is a common feature of the antiviral action of AZT and acyclovir compounds? A. Must be activated by host cell enzymes to be effective. B. Act by alkylating viral DNA. C. Block virus from entering cells. D. Are active in the unphosphorylated form. E. Are analogues of purine nucleotides. The answer is A. Must be activated by host cell enzymes to be effective. 3-azido-3-deoxythymidine, AZT, is a nucleoside analog that blocks HIV replication by inhibiting the RNA-dependent polymerase, HIV DNA polymerase. The DNA polymerase from HIV is 100-fold more sensitive to AZT than the host polymerase. AZT is a pyrimidine analog that is phosphorylated to AZT triphosphate bicellular enzymes and acts as a competitive inhibitor of the reverse transcriptase. AZT can be incorporated into viral DNA and cause chain termination because its structure lacks the 2-hydroxyl needed for addition of the next nucleotide by the polymerase. In addition to nucleoside analogues, HAART, highly active antiretroviral therapy, also contains non-nucleoside reverse transcriptase inhibitors and protease inhibitors that block cleavage of the precursors of the viral coat proteins, preventing proper viral assembly. Maraviroc blocks a specific cell receptor needed by HIV to enter the host cell. A 32-year-old female presents to your clinic with recurrent bacterial cystitis. You culture Proteus sp. from the bladder and start her on amikacin. She presents 1 week later, with no improvement. Resistance to amikacin can occur by several methods. Which one of the following methods best describes a mechanism in which an organism can become resistant to amikacin? A. Decrease in solubility in the bacterial cell membrane. B. Enzymatic hydrolysis by beta-lactamase producing bacteria. C. Inactivation of amikacin by bacterial acetylation. D. Loss of the receptor on the 50S ribosomal subunit. E. Degradation of amikacin by bacterial peroxidase. The answer is C. Inactivation of amikacin by bacterial acetylation. Amikacin binds to the 30S ribosomal subunit, not the 50S. Enzymatic hydrolysis by beta-lactamase producing bacteria targets penicillins. Bacterial resistance to amikacin can be mediated through loss of a receptor by which amikacin binds the 30S ribosomal subunit, interference with membrane transport, and bacterial acetylation, adenylation, or phosphorylation. Amikacin is resistant to peroxidase. Amikacin is only marginally soluble in the bacterial cell membrane to begin with.